So good afternoon, everyone. Thank you for joining us. My name's Lisa Cranham. I'm the Victorian Chair and the National President. And on behalf of the board, the National Board, I'd like to welcome you this afternoon. Unfortunately, we've had some technical difficulty, and John Boland, who was going to be hosting today, hasn't been able to get any sound, so I've jumped in to help. So thank you, everyone, for registering. And we are very pleased with the turnout. We've had over 100 people that have registered for today's event, which is amazing. And we would also like to thank our platinum and gold supporters as well today for everything that they do. And I would like to introduce our guest speaker, Jessica. Now, Jessica, because I've just joined, I can't pronounce your last name. Zilujko? Is it close?
Zilujko, yeah.
Zilujko,
close.
thank you. So Jess is the Director of Food, Nutrition and Dining Unit, Chief Clinical Advisor Group. And we would like to welcome Jess as she gives us our presentation. So over to you, Jess.
Thank you. So yes, a little bit of tech difficulties coming into the room today, but hopefully we'll start to see people coming in as we get started. So that's all good. And just for awareness, I can't really see my screen at the moment. So if there's any questions or anything that pops up, please, Lisa, feel free to stop me, cut me off, and just let me know, because I'm flying a little bit blind in terms of just seeing my presentation in front of me today. So so we'll get into it. So thank you to the IHHC for inviting me along to speak today on the work the Aged Care Quality and Safety Commission is doing to improve food, nutrition and dining in aged care. So as it was mentioned, my name is Jessica Zilujko, and I am an accredited practicing dietitian and also the Director of the Aged Care Quality and Safety Commission's Food, Nutrition and Dining Advisory Support Unit. So getting into our presentation, I thought it would be good just to share a little bit around the Commission and what our role is and our shared goals, just to set the scene. So as the national regulator of Australian government funded aged care services, our role is to protect and enhance the safety, health and wellbeing and quality of life for people receiving these services. So our shared goals are a great aged care experience for every older person using these services, a thriving aged care sector that accepts and delivers on the social licence that comes with being an aged care provider, and to be a regulator that has impact and delivers value for older people, providers, and the wider community. So, let's go back. So the Commission takes an intelligence-led, risk-based and proportionate approach to regulation, and our regulatory decision-making revolves around managing regulatory risks. So this approach ensures that resources are allocated to address the highest risks, prioritising the protection of consumers in aged care. So we use data and intelligence to help us better identify emerging issues or intervene early to prevent non-compliance or potential risk of harm to people receiving aged care services. It allows us to assess sector-wide trends to better understand the experience of older Australians and enablers and barriers to safe, high-quality care. This understanding drives the delivery of how the Commission influences sector performance through education and information, encouraging behavioural change and provider investment in activities that result in capability uplift. Some risk treatments are suitable for addressing a range of different regulatory purposes, and some are specific to a particular aspect of the regulatory process. So, a brief reference to the aged care quality standards to start. So the current aged care quality standards that providers are expected to be meeting. So one of the key responsibilities of the Commission is to monitor and assess providers' compliance with the aged care quality standards and other obligations. So the quality standards define what quality, safe and person-centred care should look like, and every care service must show that they can meet these standards. And this includes making sure the food and dining experience they offer to older Australians is safe, enjoyable, respectful, and based on what they like. The current standards have one requirement out of 42 which directly relates to food and more specifically meals. And I'm sure you're all aware, or most people in the room today, that this is standard for requirement 3F, where meals are provided, they are varied and of suitable quality and quantity. So a key recommendation that came out of the Royal Commission into aged care quality and safety was to urgently review the current quality standards, of which food and nutrition was identified as a priority area to be addressed. So that brings us to the drafted strengthened aged care quality standards. So led by the Department of Health and Aged Care, these have been developed and they are in their final draft. So in addition to being more streamlined, clear, robust, measurable and detailed, the draft strengthened standards place older people at the centre of aged care and provide stronger requirements for clinical care and food and nutrition. And as I'm sure most of you are aware, now includes a standard that's dedicated to food and nutrition. So Standard 6, which is the food and nutrition strengthened standard that's in draft, describes the aspects of food, nutrition and the overall dining experience that impact on older people's quality of life. It has 4 outcomes which highlight the importance of partnering with older people to provide enjoyable food, drink and dining experiences in line with contemporary evidence-based practice that meets the needs, goals and preferences of older people living in residential aged care. In addition to Standard 6, Standards 3 and 5 also link in with nutrition and hydration in the context of assessment and clinical safety for chewing, swallowing, nutrition and hydration. So the strengthened quality standards are not yet in operation. They are expected to be introduced with the commencement of the new Aged Care Act after it is approved by Parliament, with the existing or current standards remaining in effect until then. The Commission have released a suite of fact sheets to help providers understand the new strength and quality standards and their obligations in meeting them, including a framework analysis that compares the current standards with the draft strengthened standards to better help understanding of the changes that occur or will occur through these strengthened standards. Oops. So just before I move on to the next slide, I just wanted to highlight that while compliance is essential, the Commission encourages providers to strive for excellence beyond meeting what is required, and providers should aspire to meet a high standard of food, nutrition and dining that is person-centred to meet the needs and preferences and optimise the health, wellbeing and quality of life for the people that they're caring for. So for older people, appropriate and adequate nutrition and hydration are critical, as poor nutrition can lead to serious adverse outcomes to their health, wellbeing and quality of life. And is especially important for those in residential aged care, where most often older people are reliant on the food and drinks provided by the service to meet their nutritional needs. Furthermore, food and nutrition are not only essential to physical health, meals and the act of dining are integral to mental health, wellbeing and overall quality of life. So that brings me to where we've been and starting to look at what the Commission are doing in this space. So what has been the journey so far for the Commission? Well, we've been looking at issues around food, nutrition and dining for some time. And as I mentioned before, food and nutrition were identified as one of the 4 areas of concern recommended for immediate action and attention in the final report of the Royal Commission into Aged Care Quality and Safety. And to address these challenges, the Commission has implemented a regulatory campaign designed to drive behavioural change and to support the sector to improve the delivery of food, nutrition and dining for older people receiving aged care, whereby the Food and Nutrition Expert Advisory Group was established and comprised of experts from various fields, including consumer advocacy, nutrition, dementia care, and also oral health. So the group identified 4 priorities for improvement, and this includes the dining experience, choice, swallowing, and oral health. And with their expert input, a suite of resources have been developed for each priority area to support providers, their staff, and people receiving aged care. So through this process, the Commission also sought and actually continue to seek to improve our understanding through various research activities to help us better identify and address risks and harms associated with food, nutrition and dining to improve the quality of care provided to older people. So we gain our insights through analysing complaints made to the Commission about food, nutrition and dining to better understand the challenges and to identify those specific areas of concern. We also undertake research and analyse literature to gain insights on current evidence and best practice, including innovations providers are using to improve meals, nutrition and the dining experience. And we also undertake interviews and consultation with key stakeholders to gather insights from people in residential aged care, capturing a diverse range of experiences and both negative and positive feedback. All of these initiatives and research activities provide us with a comprehensive understanding of the food and dining landscape in residential aged care. And by examining both negative and positive experiences, the Commission has been able to and will continue to identify areas of improvement and areas of success within the aged care sector. So the findings from these initiatives inform the recommendations for consideration by the Commission, and by leveraging data-driven insights and consumer perspectives, we can develop targeted strategies to address issues and enhance the overall quality of food and dining experiences in residential aged care services. So where are we now and where have we gotten to? So in the 2023-24 budget, the Australian government allocated almost $13 million, so $12.9 million, including $7.7 million provided to the Commission over 2 years, to strengthen nutrition in aged care. And this funding supports the Commission's regulatory campaign to improve food, nutrition and dining. As part of this initiative, the Commission has established enhanced support functions through a dedicated hotline for people to contact us for support with food, nutrition and dining related matters, and a food, nutrition and dining advisory support unit, which is my team, that is comprised of highly experienced dietitians and speech pathologists to enhance its support to the sector for food, nutrition and dining related matters. The Commission has also increased its risk-based monitoring activities, conducting up to 1,440 targeted assessment contact visits over 2 years with a focus on food, nutrition and dining. And I will provide a little bit more detail on these and this particular activity a little later on in the presentation. So we've also engaged Dr. Cherie Hugo as a special advisor to provide expertise and support for the food, nutrition and dining campaign. And we are also continuing to develop and offer educational activities and resources to help providers identify and address issues that impact older people's ability to eat and drink well. These efforts aim to enhance the capability of providers and their staff and ultimately improve the quality of care in relation to the food, nutrition and dining in aged care. So as I mentioned, one of the major initiatives of the campaign has been the establishment of the Food, Nutrition and Dining Hotline, which started operation in July 23, so July last year. And the hotline is available for approved providers, aged care staff, health professionals and people receiving aged care and their representatives to contact us with inquiries, questions, concerns and complaints about food, nutrition and dining. It gives callers access to dietitians and speech pathologists in the Commission's Food, Nutrition and Dining Advisory Support Unit, who are available to provide expert advice and guidance on food and nutrition related matters and issues. The Food, Nutrition and Dining Unit are a group of passionate and very experienced health professionals in aged care, food, nutrition and dining. And in addition to providing expert advice and guidance through the hotline and other regulatory activities, we're supporting the Commission's work in informing, educating and regulating the sector in relation to provider obligations. We're also supporting services to understand their obligations in line with the standards to provide person-centred care with respect to food, nutrition and dining. So this includes linking providers with education and resources to support staff to have the skills, knowledge and competence to understand and provide appropriate and effective care and services. And it's very bright and up on the screen at the moment, but the number for the hotline, should you wish to call, is 1800 844 044. And you'll see that number scattered all across the slides for the rest of the presentation as well. So in terms of complaints and inquiries related to food, nutrition and dining, not all are received through the hotline. We do have other avenues of contact available, which includes web form, emails, letters and calls to our general 1800 contact centre phone number. But just to look at complaints specifically and provide a little bit of context here in terms of what we're seeing, the Commission receives predominantly food-related complaints about adequate nutrition and or hydration, as well as allied health assessment and services, the quality and variety of food, and the choice of food. So the Food, Nutrition and Dining Unit provide clinical support, case guidance and advice to Commission staff to support regulatory decision-making on many of these matters. And in cases where a caller has made a complaint about the quality of food in a service, a dietitian from the unit has supported conversations between the person making the complaint, the Commission's complaints officer and the provider. So I just thought I would also focus in on some of the cases that are specifically supported through the hotline. So when we're looking at specific inquiries. So it's not all about making complaints. That's not all that we receive through the hotline, and it's also not all that we encourage to come through the hotline. Another core purpose is to provide callers with an opportunity to engage dietitians and speech pathologists within the unit on their questions, concerns or inquiries related to food, nutrition and dining experience matters. So some of the matters that the unit have supported callers with to date have been, well, they've been very diverse, and they've included things such as wanting to seek information about choice, quality, quantity and variety of food and meals, as well as the timing of meals, mealtime assistance and support, also food-related engagement strategies and feedback processes, and food and nutrition training and education for aged care staff. So most of the calls that the unit supports with, more specifically, are regarding specific or special diets. So this has included matters such as texture modification and thickened fluids, and those required, or those diets, sorry, that are required for medical reasons, cultural preferences and religious beliefs. We've also supported quite a lot with food advice, specifically training courses, education and food safety information, and also information on the quality and variety of food served. Other matters that we've received requests for have included for information and guidance relating to food preparation and service, such as understanding nutritional requirements, guidelines and standards for menus, and for ways in which older people can be supported to receive mealtime experiences that are dementia friendly. So in addition to expert guidance from our team of dietitians and speech pathologists, callers have also on occasion been referred to current legislation and the aged care standards outlining provider obligations, and also the Commission's resources, including the suite on food, nutrition and dining materials. We've also referred callers onto other government initiatives, particularly when it comes to requests around training and education, such as fee-free courses funded through the federal government on food, nutrition and or dining. So one of the matters that I will touch on as well is that we've referred callers through to local food safety authorities, as food safety is not regulated by the Commission. It's it sits with state and territory governments to enforce food laws, which include the national standards on food safety in their respective jurisdiction. Other referrals we've sent through have been to advocacy bodies such as OPAN and Dementia Australia, and also to peak bodies such as Dietitians Australia and Speech Pathology Australia, for further advice and information on the roles of various health professionals such as dietitians and speech pathologists, and ways of accessing services and other support such as education. So focusing now on the different types of inquiries and who we're receiving them from. So most of the calls the unit receives through the hotline are from consumers and representatives, accounting for half of the inquiries that we actually support with. Most inquiries we receive from consumers and representatives are related to specific dietary requirements and the quality and variety of food and meals. More specifically, the unit have provided support and guidance to consumers and or their representatives on matters such as medical, religious and cultural diets, including texture modified foods and food allergies and intolerances, food safety, linking people in with local food authorities for support and advice, and also navigating choice and guidance for older people receiving home care packages. We've also supported on specific matters around the choice and quality of meals. In fact, we've had a number of calls where we're supporting residents and all their representatives with advice on how to access the services of speech pathologists or other health professionals to assess and support services with understanding processes that allow consumers to eat and drink with acknowledged risk, or when they've been concerned that texture modified foods provided are not aligned with either the health professional's recommendations or allowing for adequate choice. So we've also supported callers with their questions and concerns regarding nutritional standards and provided resources on the quality standards and provider responsibilities. And as I mentioned before, referral onto advocacy groups to support feedback and complaints processes, and also supporting and promoting self-advocacy to ensure meals are aligning with needs and preferences. So when it comes to providers and staff, so you can see we're hearing from a lot of providers and their staff. And the main queries that we're getting are in relation to food advice, lessons and training and food safety. So these specific matters account for half of all of the inquiries that we receive from this group. So more specifically, we've supported with the interpretation and clarification of provider responsibilities and best practice for food, nutrition and dining on topics such as texture modified food and fluids. You can see a little bit of a recurring theme occurring across all of our inquiries here, as well as food related strategies and support for people living with dementia, cultural requirements and choice, mealtime support and assistance, consumer advisory bodies and feedback and consumer engagement strategies, food quality, food safety regulatory authorities and allergen management, as well as training and best practice resources available through the various education modules, national guidelines and dementia support training that is available. So we've also supported and assisted health professionals. So this can include professions such as dietitians and speech pathologists to understand and interpret evidence-based and or best practice guidelines around eating and drinking with acknowledged risk, menu standards, guidelines and requirements within aged care, malnutrition screening and validated tools, indicators for referral to allied health professionals for support, and how and with what issues these professions can support with for food, nutrition and mealtime requirements, as well as nutritional supplement provision and guidance around that. So I thought in consideration of the audience who are joining us online today, that it would be good also to highlight some of the specific support and guidance we're providing around, for food service staff. So some of the key matters that we've been supporting with here or have been receiving inquiries from kitchen and catering staff, including management of those services, relate to food advice, lessons, training and food safety. And more specifically, the matters that we've supported on, again, is around texture modified foods and thickened fluids, including understanding of the frameworks and compliance for menu items, understanding menu requirements, more specifically around choice, and provider responsibilities to support choice more broadly across the menu and at meal times, such as supporting change of mind at meal services and medical and cultural requirements for menus. So we've also supported food service staff around how to support consumers to eat and drink with acknowledged risk. So again, feeding back into that topic of choice, and also provided guidance on engagement and consultation strategies with consumers to gather feedback and adapt processes to improve satisfaction and the consumer experience. So this might include things such as using feedback and the obligations under the standards for feedback to review and update the menu and inform quality improvement activities. So other specific guidance or matters that we've been requested to support with are also around food safety regulation, including the requirements around training and directing to relevant food authorities on regulatory matters, And finally, also linking in these inquiries or inquirers with the current quality standards, and also providing information to help them to understand their responsibilities, and also where they can find information to understand the potential changes of the new strengthened standards, noting that the answers that we're able to provide on these at the moment is quite limited in regards to the final draft of the strengthened standards, due to the guidance still being in draft and those standards not yet being passed by Parliament. So I'll take the time now to also just highlight a call that we've received that was from a hospitality manager who we supported in some advice and guidance around engagement and consultation strategies to improve their food, nutrition and dining experience within the service. And the manager called the hotline, well, I started off at the beginning. So the manager called the hotline requesting guidance and information on food focus groups as they were looking to commence these at their service, and resources they could utilise was also something that they were seeking on this matter. So specifically, they asked for guidelines and best practice regarding food focus groups and how to measure and document the outcomes and successes. So the unit, or the expert within the unit who supported this call, provided general advice on the importance of consumer feedback and engagement through mechanisms that are most suitable and appropriate for the service to ensure high quality, person-centred care, and to consider organisational policies and processes that may influence how these run. And also what kind of documentation would support these processes, and how feedback and complaints processes were essential in meeting their obligations under the aged care standards. Furthermore, we also highlight that supporting person-centred care and consumer engagement and consultation on the care and services they receive is very important as well in terms of their quality improvement processes and meeting their obligations. So when we followed up with in writing to the caller, we provided some information on goal planning tools, practical guides for effective engagement, and commission webinars that were available that related to this request. And we also provided advice on measuring success through SMART goals, the key personnel to include, including consumers, and how food focus groups and other consultative processes with consumers support meeting their provider obligations under the aged care quality standards, specifically around feedback and organisational governance. So, as I mentioned earlier, I'm just shifting away now from the matters that we've supported with, and just want to touch on another key initiative being undertaken by the Commission that I mentioned previously, which is the assessment contact visits with a focus on food, nutrition and dining that are occurring. So as the National Regulator of Australian Government funded aged care services, we undertake quality assessment and monitoring activities at residential aged care services. And between May 2022 and June 2023, we conducted 130 targeted assessment contacts that focused on food, nutrition and dining. So we use a risk-based selection methodology to identify services considered to be higher risk to ensure we're engaging with services of concern. So during these site visits, the Commission's Quality and Assessment Monitoring Group team assessed key areas and known issues pertaining to food, nutrition and dining, and they found both good and poor practices occurring. And as part of the budget measure to strengthen nutrition and aged care, the Commission has increased our risk-based targeted monitoring activities to 1,440 over 2 years, with the food, nutrition and dining units supporting these visits undertaken at higher risk services. So these unannounced site visits were in addition to the existing performance assessment and monitoring activities that the Commission were already undertaking and are undertaking. So following its establishment, as I mentioned, the unit have been supporting the Food, Nutrition and Dining Target Assessment Contact Initiative nationally, and this includes both on-site and off-site support, prioritising attendance at higher risk services with the quality assessment teams. So the dietitians and speech pathologists from the unit are working alongside the Commission's quality assessors and providing subject matter expertise throughout the entire targeted assessment contact process to understand and identify food, nutrition and dining related risks and support the uplift in provider capabilities to improve food, nutrition, dining experiences for older people. So through these visits, some of the main challenges and issues we have seen and are hearing across services have included matters such as a lack of choice in meals and dining options, poor understanding or adherence to modified food and fluid frameworks and strategies and or interventions recommended by health professionals to support consumers at mealtimes. Also, poor processes to support consumers who choose to eat and drink with acknowledged risk. We've also seen processes around malnutrition screening and management in some cases to be lacking, with inadequate monitoring and follow-up of consecutive weight loss and a lack of timely referrals to health professionals or actual referral when clinically indicated. And in terms of environment, we've observed in some cases noisy dining areas, rush service and minimal engagement and communication by staff with residents during these times. So specific to staffing, we've noticed some challenges around staff having the knowledge of more specific care needs and strategies, such as for those living with dementia with special or requiring special dietary sort of intake or meals. And also we've noticed some challenges around capacity and capability to supervise and assist consumers at mealtimes when this is required. So even though I'm identifying through this that there is some lack of training and skill development for staff in food service and nutrition and hydration related issues, when we are engaging with staff on site and providers, there is a strong desire for further training in this, and it's very encouraging actually that when we're speaking that there is something that is being sought by those staff to understand how they can best meet the needs and preferences of the consumers. So it's not all issues and challenges that we're seeing on these visits either. Some services are demonstrating really good practice around food, nutrition and dining. And these include things such as the identification and allocation of food, nutrition and dining champions through a program or through identifying staff to support that role. Also engagement of specialist services or consultants to provide additional support, such as consultants to provide additional support and strategies to staff to support those living with dementia. We've also seen some great initiatives through on-site gardens and consumer recipes and cooking activities that in some cases utilise those gardens and have an interactive experience for consumers. And we've also seen services arranging bus trips to favourite restaurants for birthdays or to enjoy traditional foods, and also the celebration through food of religious and cultural festivals and days of observance. So another great initiative, or I guess great practice that we saw across some services, was the training and education for all staff in food, nutrition and dining. So not just limiting it to the care and clinical staff. We saw some services providing this training to management and admin staff, so they have that understanding and awareness around those key issues in food, nutrition and dining to be able to best support and identify. And then finally, we saw some really great use of technology to improve both the dining experience and the quality assurance and communication of meals, which was fantastic. So that brings me to the next stage of where we are going. So quite broadly, food, nutrition and dining will continue to be a focus for the Commission. So we will be looking closely at our priority areas of dining choice, swallowing and oral health, as well as food, nutrition and hydration practices more broadly to see how the sector is performing and what work is being done to improve food, nutrition and the dining experience for older people. So we're also looking at ways in which providers are identifying, understanding and managing the specific issues and challenges that may present for aged care recipients, with a focus on people living with dementia and those from culturally and linguistically diverse backgrounds. So the F&DU, so that's, sorry, I'm using short-term language there. So the Food, Nutrition and Dining Unit are supporting our Commission staff and providers in understanding, identifying and responding to these issues and risks through education and the provision of expert advice to support best and evidence-informed practice. So we want to know how services are providing person-centred, safe and nutritious meals and menus that align with recommendations and best practice frameworks and standards, and supportive and enjoyable and safe mealtime experiences that ensure consumers are provided what they need to dine with dignity, comfort and choice. So we also want to know how providers are supporting choice, including how they support older people to make informed decisions regarding their food and fluid intake, and also how staff are recognising and responding to signs and symptoms of eating, drinking and swallowing difficulties and poor oral health. We're also looking for how services are engaging and partnering with consumers and providing adequate and appropriate communication, assistance and mealtime support. So also, as I mentioned at the start of the session, when referring to the final draft of the strengthened standards, that the Commission are continuing to work on supporting the sector to be prepared for the strengthened standards. So we're consulting on our draft guidance resources to help providers, aged care workers and other stakeholders to understand the new strength and quality standards and their roles and responsibilities in meeting them. So we're welcoming responses from providers, aged care workers, older people and their representatives, as well as other stakeholders, as your responses will help us to produce resources that are fit for purpose, easy to understand and support the delivery of quality, person-centred aged care. So I've just got a little note on the slide here, just as a reminder that consultation actually closes on the 19th of May. So that's coming up very, very quickly.
Hi, Jess, just before you continue, we've just got a quick question, and it's,
sure.
Are the FNDU providing support and guidance to assessors in all states?
Yes, we are. Yes. So this is a national program. So we are a national team. So we do have coverage nationally. So the support that we provide, it does go across all states and territories.
Thanks, Jess.
Excellent. Thank you. Great question. Okay. So so another initiative of the Food, Nutrition and Dining campaign that I just wanted to touch on very quickly is the Menu and Mealtime Review Program. So the Commission is collaborating with the Department to deliver a program to support improvements to food, nutrition and dining in residential aged care through an independent dietitian-led review of services, nutritional care menu and the mealtime experience. So there's a limited number of aged care services that will be supported with expert assessment and recommendations from accredited practicing dietitians, which will include feedback and recommendations specific to their service. So the menu and mealtime reviews at residential aged care services will be fully subsidised by the department under the budget measure and is open to all approved providers of residential aged care services. So expressions of interest have been open for services to nominate to participate in this program. However, it's important that I mention that lodging an expression of interest does not guarantee a menu and mealtime review, as I mentioned, the places are limited and access to the program will be prioritised based on selection criteria. And in fact, the expressions of interest process does close today. So for more information on the program, you can visit our website. I've got the details up on the screen there now, but you can also call through to the Food, Nutrition and Dining hotline or email us at info@agedcarequality.gov.au. I will have those details for contact put back up on the screen when I finish very shortly as well. So, as a national regulator of aged care, and I've mentioned at the start of the presentation today, so the Commission not only assesses and monitors providers' compliance, responds to non-compliance and manages complaints, we also have an educative and awareness raising role. So the Commission has developed and offers a comprehensive suite of food, nutrition and dining resources on its website. And we have dedicated pages for providers, workers and older Australians that provides targeted content on food, nutrition and dining. So these resources provide valuable information on supporting residents and older adults and addressing health issues that may impact on their ability to eat and dine well. So to complement these resources, we are continuously analysing data and trends from the activities we're undertaking, such as support through the hotline, site visits and other sector engagement initiatives to develop more resources and education materials for the sector that are based on the needs that we're hearing to improve food, nutrition and dining in aged care. So findings from our regulatory and non-regulatory activities are analysed for trends and gaps to help inform these resources and initiatives that we develop and implement to help with this process. So as I also mentioned a little bit earlier, we're in the process of developing a suite of specific resources to support those living with dementia. And we are also in the process of developing a toolkit resource to further highlight the importance of having effective strategies for involvement and co-design with older people in improving food and dining experiences. So that's actually what was the topic of the case study that I ran through just before. So we also have a page on our website called Food for Thought, which is a compilation of ideas and positive stories that we have gathered from across the industry over the last couple of years. So a new story is published in each quality bulletin. And in fact, to stay on the topic of consumer engagement and consultation, that is the topic of this month's Food for Thought story. So I encourage you to check it out. We also regularly run webinars for the sector, with several recently being provided on specific food, nutrition and dining related topics. So our most recent food, nutrition and dining webinar focused on dementia and its impact on eating and nutrition. And we have ongoing collaboration with experts from Dementia Australia to develop additional resources to complement the suite that you can see up on the screen here. So the Commission also has online training modules known as ALICE modules that are freely available to individuals working in Australian government funded aged care services. And these modules complement the Commission's resources, providing interactive and engaging learning opportunities for aged care professionals. And we have a number available online at the moment, with the most recently one released being specifically on texture modified foods and thickened fluids. So just in regards to how we utilise information we're receiving through our activities, it's a bit of a call out. You know, if you've observed in your work any initiatives or innovative practices that aged care services have successfully implemented or that you yourself are implementing in your service, we're really keen to hear from you, and details on how to contact us will be up on the last slide in a moment. So I do encourage you, to contact us and also to use and promote these resources widely with your network, as they're there to help providers and staff to understand why food, nutrition and dining is so important to the health, wellbeing and quality of life of older people. So finally, the Commission, in terms of understanding how our initiatives are working, the Commission will undertake ongoing evaluation of food, nutrition and dining initiatives implemented through the campaign to understand their effect and inform future activities. So we're intending to undertake a survey with specific professional stakeholder groups servicing the sector to better identify and understand the risks and issues associated with food, nutrition and dining in aged care, with the target audience of this survey being dietitians, dental and oral health practitioners, speech pathologists and occupational therapists. The information that we gather through this survey, together with our regulatory data and intelligence available to the Commission, as I mentioned, will be used to inform the Commission's risk treatments and regulatory campaign activities in relation to food, nutrition and dining, and will be used to assist in evaluating the impact and benefits of the Commission's work in this area to people receiving aged care over time. So this survey is currently under development, and watch this space and for communications on when it is released. And that actually brings me to the end of the presentation. So I hope that that's provided a really thorough overview of what the Commission's doing, what we're seeing, and then what we're planning to do to improve or to continue to improve food, nutrition and dining across the aged care sector. So thank you.
Thanks, Jess. Now we have one more question, and it is, can residents in RACF have nut products provided as part of the menu when the kitchen is part of a hospital and very concerned about allergens? Are there regulations for RACF?
Okay, so that's a question that would best sit with your local food safety authority. So really it depends. So there's a couple of things here. So saying that it's linked to a hospital, it would depend on the standards and requirements for nutritional guidelines or for the provision of menus more so, and what that dictates the menu to include and how their kitchen operates and what their food safety plan may entail, but certainly
just jumping in. So RACF stood for residential aged care facilities. So it wasn't
no problem. Yep, I got it. I know all the lingo now. We hear all the acronyms, so that's all good.
I wasn't sure about that one.
Yeah, no problem. I would definitely recommend reaching out to your local food safety authority. So in terms of, what that food safety, the advice that I can provide here is very general, but in terms of the what that food safety plan or the manual stipulates can be provided, potentially will dictate what that menu will also provide for that service. But in the first instance, I would reach out to your local authority who would be able to provide some further advice on that and what may be allowable depending on that food safety program. And also what comes under the, if it's a public sector hospital and what their standards and guidelines also indicate that to be.
Thanks, Jess. We've had a thank you from Alison. Do we have any more questions for Jess?
It was very comprehensive, so it's a lot to take in.
So just while we are waiting, oh yes, we've got another question. Can you provide some strategies on providing choice in small regional residential aged care facilities with limited food service support?
Okay, so I might just I'll bring up that question. I'll have a look in the chat just while I'm bringing that up.
So I'll say it again. Can you provide some strategies for small aged care facilities?
Yeah, so I guess a lot to unpack there as well, because I think what we always bring it back to is what are the choices that consumers are wanting, and might be best supported with the resources that you have. Certainly in this case, I would recommend calling through to the hotline, where our experts can certainly support in going through some strategies for you. But yeah, it would be a little bit more, and I think our unit would like to unpack with you just around what the current barriers might be and what some of those strategies could be recommended to support you in this case.
Do we have any more questions from anyone? Oh, yes. So the next one is, there's a lot of emphasis on dietitians within the budget and your within the budget and your presentation, and a significant amount of focus on food. However, do you employ speech pathologists, and can you explain their role within the unit?
Yeah, sure. So, so in terms of speech pathologists, so yes, we absolutely do employ speech pathologists. We have speech pathologists within the food, nutrition and dining unit, and they are very experienced in aged care and supporting with the specific matters that we see across the sector. So just to highlight a couple of those specifics, so texture modified diets and thickened fluids, our team there of speech pathologists have supported a lot of callers with understanding, you know, what the frameworks are and what providers' obligations are around meeting the needs for texture modified diets as well. So ways of engaging speech pathologists to understand if food and fluids do comply with those texture modified or thickened fluid requirements, as well as how, I guess, services or staff or consumers or representatives can also locate speech pathologists. So we've referred a number of inquirers on to Speech Pathology Australia to be able to locate a speech pathologist in their area who is also able to support in these matters. Our speech pathologists have also provided quite a lot of support on eating and drinking with acknowledged risk. So they're able to provide a little bit more guidance on what that means. So the fact it is a process that supports consumer choice whilst also allowing them to make informed decisions and take the risk to choose to eat what they want if they're choosing to, you know, not consume the food or fluids that are part of a recommendation, either wholly or for some foods. So yeah, our speech pathologists, they're probably the key areas that we've seen there. They also support a lot at the moment across our education pieces. So supporting sector education materials in the development and also development around our webinars and also our Alice modules that are available too for services to access. Oops, you're just on mute there, Lisa.
Sorry.
It's okay.
So the next question is, will the Commission track the questions used by the FNDU and use the questions during the targeted visits?
Let me have a look. Sorry, I'm just
Do you need me to say
my
it again?
screen's going. Yeah, that'd be great. Thank you. And I'll stop showing my screen because I think that's impacting how I'm able to see
sure.
these coming.
So will the Commission track the questions asked to the FNDU and use the questions during targeted visits?
Yep. So the Commission gathers a variety of intelligence to inform targeted assessment contacts. However, they don't necessarily track individual cases for follow-up on targeted visits. Our role within the quality assessment visits is to not investigate complaints or inquiries, rather to look at the food, nutrition and dining experience more wholly. So to monitor what's happening and to understand providers' performance in that space. So I hope that's helpful.
Thanks. We have one more question. This will be our last question. Does the Commission foresee any issues with meeting the new strengthened standards in line with current funding processes, i.e. daily fee?
Foresee any issues with meeting? So that's probably not something I'd be able to comment on, sorry, in this forum. Do we foresee any issues with meeting in line with current funding processes? Yeah. Sorry, that's probably not something I'm able to comment on. I can certainly take that offline though and just have a bit of a think and get some support from within the Commission to support a response to that. But yeah, it's probably not something I would have an opinion on at this stage in terms of it. But, you know, one of the things that we are striving to do is to make sure that we are supporting providers in understanding their obligations there, but also supporting with the resources to be able to meet those needs. So apologies, I can't provide too much of an opinion on that in this forum, but certainly happy to take that one away and support a response offline.
Yeah. Thanks so much, Jess. And I think that's all we have time for today because we're coming to the end and I know that everyone is quite busy. I just want to thank you for your presentation. I think it was very interesting and that you can see that there are so many passionate people online that were really keen and passionate about what they do in their jobs. So I think, you know, it really is fantastic to see that there were so many people wanting to see your presentation. I was really interested in the fact that you've got so much support for us as well. And I work in a hospital, I don't work in aged care, but I was really thought that the support that you had for our members in aged care was amazing. The webinars, posters, online training. So I'm going to get in touch and have a chat with you a little bit more about how we can get those resources out to our members and make sure that, you know, that the people that are, like, one of the questions was about, you know, the smaller aged care facilities. They're the people that need the support the most. And if we can get some support out to those people and help make improvements, I know within our members, there are lots of members that are passionate and doing so much amazing work in aged care. And, you know, if we can support other aged care facilities to make improvements, it would be amazing. So I think we can work together with the Commission, definitely, to support each other. So thank you so much. And I'd like to thank everyone else for coming along. Really appreciate it. And it is heartwarming to see so many people with such passion for the industry. So thank you, and have a lovely afternoon, everyone.
Excellent. Thank you.